that we carry and use every day, and all of those gifts and resources we get from the land and the water. We say miigwech for all of those things. I want to acknowledge you and all the work that you are doing to help your community members, and ask the grandmothers and grandfathers and Creator to watch over you, your family, your children, your relatives, your pets, and your community, that they are healthy and safe. I acknowledge that the sickness is still out there, and asking for prayers for people who are suffering and for the loved ones who have lost loved ones to the sickness. I want to acknowledge all those who have passed on because of many health struggles. I am asking for prayers, and asking for prayers for those who may have other struggles in their lives. And finally, I ask for prayers for the little ones, that they may be kept safe and protected, and that they find their way to their families. I want to say miigwech to the drum group, Young Medicine, for traveling to be with us here today and to offer some honor songs. I want to say miigwech. Thank you to everyone for listening and being a part of today's event. Miigwech.
Thank you so much for that. Excellent. Thanks everyone for coming. I'm Dr. Matt Folwell. I'm a radiation oncologist and the chief of oncology here. I first wanted to start off by a couple of thank yous. This wouldn't be possible without the dedicated team that we've had at RVH, Claire Mins and Katie Woodcroft taking over very adeptly. I want to thank Jermaine and all her guidance, and Janice and your guidance making this possible. I think it's really important that we continue to move this forward. This is a start, and there's more to come. I'd like to invite Roberta, one of the Manitowoc group, up to discuss things a little further and our plans as we're going forward. And I'll hold your hand.
Thank you. Chanie, Roberta, Métis, Root, Dishnakas, Chinasi, Donjaba, Makwa, Dodiem. Hi everybody, I'm Roberta Métis Root. I'm from Bosley First Nation on Christian Island, and I'm Barrie Clan. I am the Indigenous Patient Navigator here for the Simcoe Regional Cancer Care Program. I am honored to be part of the team celebrating the launch of the first Gord, Downie, and Chanie Wenjack Fund Legacy Space in a healthcare setting. This launch is an important step towards truth and reconciliation, providing space and opportunity for reflection and Indigenous cultural safety training for Team RVH. I'm hopeful that our commitments to reconciliation will inspire healthcare centers across Canada. And one of my goals as an Indigenous patient navigator is to take daily steps towards cultural safety and relevant care for all Indigenous patients and families. This legacy helps move my goal forward. I want to thank Dr. Folwell for your leadership on this project, and Katie Woodcroft, you've been amazing in planning everything, and Claire Mins is here, yay! And Janice, everybody, Teresa, thanks for coming, the drum group, everybody, thank you, miigwech.
Thank you everyone for being here today. We have been working together on this project for more than a year now to bring this legacy space to life with your incredible team, and it feels so good to finally meet you all in person and celebrate this accomplishment with your colleagues and your community here today. Angela and I are honored to be here to represent the Gord, Downie, and Chanie Wenjack Fund for the first in-person legacy space celebration and launch in nearly 2 years. But more importantly, as you've heard here today, this is the first time ever that a legacy space has been created in a healthcare setting. So yes, absolutely. There have been a lot of industry firsts from our partners in this program, but this one is historic to say the least, and it represents a very, very important step forward in improving health services for the Indigenous community. When I first learned about the plan for a legacy space on the RVH campus, we were only a few months into the pandemic, and I remember all of us being so moved that a group of healthcare professionals were dedicating time to this during what must have been one of the most stressful and uncertain times of their careers. To make this project a priority and to do so with such thought and care and meaningful consultation is a testament to RVH's commitment to acknowledging truth and working towards reconciliation. Our organization was created by two families coming together to inspire change, to honor Chanie and Gord's legacies, and to build awareness, education, and connections between people like we are here today. When Gord and his siblings learned about Chanie's story, he had been a touring musician for more than 3 decades at that point, and had devoted his life to writing about what he thought was the Canadian experience. He realized that if he were only discovering the truth about residential schools towards the end of his life, there are many more like him, and this lack of understanding is what contributes to division and inequity. He wrote 10 poems about Chanie privately, and with the blessing of the Wenjack family, these became 10 songs, which became a graphic novel, or denied that education earlier in life. Creating a dedicated space for growth and learning empowers us all to be part of the conversation and create changes in our workplaces and communities. All it takes is that first step, or a meaningful action that moves reconciliation forward. We call this reconciliation, and I know there will be many examples of that in the years ahead as your visitors, your staff, and patients at the hospital encounter the legacy space in the atrium and they interact with the learning materials they will be sharing throughout the campus. And I want to say that it's especially meaningful that we are coming together to hold ceremony and celebrate this accomplishment during Secret Path Week. This is a meaningful week for us as October 17th and October 22nd are the dates that Gord, Downie, and Chanie Wenjack each joined the spirit world. This Friday will mark 55 years since Chanie left us. And the events of the past year are a reminder of how much work there really is left to be done. It's been clear from the very beginning that for RVH this was never just a box to check off or an obligation. This was a passion project and a clear demonstration of the values that set your organization apart. We are so grateful for the support and the friendship of Katie Woodcroft and Dr. Falwell, who championed this project, and to the physicians and their family members who stepped up to provide the funding, and to the Indigenous Health Circle for their guidance and collaboration. So please join me in giving them a round of applause. And thank you all for coming here today to talk about this project.
Let's see if I can do this without knocking the mic over. Apparently not. I'm just going to ask Elder Teresa Sandy to do the close, because I think you would agree with me that she is such a wonderful elder in leading us that it's only appropriate that she proceed with the close of the ceremony. I am handing tobacco, left hand to left hand, to Teresa Sandy in thanks, in anticipation that she'll say yes. Thank you, Marcy, Chanie. My name is Roxanne Shank. I'm president of Barrie Métis Council, and I stand before you today with our Senator Lisa Tessier and our Chair Tony Muscat, humbled and grateful to be included with you on this important occasion. RVH is, to my knowledge, the only healthcare institution who at this point in time is sponsoring and is part of the Downie Wenjack Legacy Fund. The desire to welcome Indigenous persons to a safe place, and the recognition that historical trauma is still being lived out in our communities, is a woke moment at which we all start the path of healing together. The land we stand on has traditionally been the home of First Nations and Métis people from across Turtle Island. We are grateful and privileged to have the opportunity to live and work in Simcoe County on this territory. What does it mean today to say that more than 150,000 Indigenous children attended residential schools from the 1800s through to the closing of the last school in 1996? Isn't Chanie Wenjack's death old news, as someone said to me? The answer is no. Chanie's death is not old news. It's today's patient. Increased rates of chronic and infectious diseases and caused distress, depression, addiction, and suicides. Children were systematically starved, subjected to medical experimentation, and forced to give up their native language and their religion. It is estimated that only 5 of 8 children who attended residential schools graduated to grade 8. The rest died from abuse or from freezing to death trying to get home, as did Chanie Wenjack. Recently, it has become public knowledge what many residential school survivors already knew, that there are thousands of unmarked children's graves near residential school sites. The pain and the grief is real, and it flows through each of us and through our families and our communities. The legacy of residential schools, the 60s scoop, and the missing and murdered Indigenous women and girls in our communities continues. In the face of all of this, however, I have tremendous hope and unwavering faith. If we accept that things must change
they will change as we walk in soft moccasins and share the truth that leads towards reconciliation. By raising awareness, we can create opportunities for change, creating a safe space such as the Downie Wenjack Legacy Space here today at RVH. We can do this. We can, while honoring the past, create a better future for our children and our children's children. Thank you, merci, marci, miigwech, for the opportunity to share with you today. It's a rare privilege to connect outside in person with shared resolve and shared healing.
Ani, bonjour. Sakajawaya Peninsula Edition Kazu. Genabajin Dojima, Hanishnami Kwendam, Gigo Dodem. Good afternoon, everyone. My name is Julie Elliott. My spirit name is Panasi Kwai. I want to thank all of the speakers before me who've described and shared why we are gathered here today, who talked about this legacy that we all live with. And for myself, my grandparents and my parents went to residential school. I'm impacted by the residential school system, but I want to share with you that we all are impacted by the residential school. Every single one of you that have joined us here this afternoon. And I want to acknowledge the work of RVH in their efforts to seek reconciliation, but to go even deeper than that, to begin to look at the systemic practices within the healthcare system that inhibit or often detract access to good healthcare by Indigenous peoples throughout our county. And I want to commend them in taking this step in acknowledging and honoring that partnership. I also chair the Indigenous Health Circle for our region, and the Indigenous Health Circle is a long-standing collaborative partnership of Indigenous healthcare providers in Indigenous communities and non-Indigenous healthcare providers, essentially anyone who wants to advance the improvement of Indigenous healthcare. So we meet bi-monthly, and it's through the work of these dedicated professionals and community members throughout our region that we've been able to advance some of the changes and improvements that we've seen. I also want to acknowledge the letter of relationship that RVH has with the Barrie Area Native Advisory Circle in doing some of this good work. I also want to, in talking about the need for action, and not just action, but courageous action. And when we talk about dismantling oppressive systems that maybe were not intentional within the healthcare system, but certainly exist within the healthcare system, I want to say that it is my hope that this work continues, that each institution, each service provider, each individual looks deeply within themselves to understand how we need to do better and how we can do better. I absolutely believe that, and I think the evidence and proof is around us. We are getting ready to unveil this very beautiful acknowledgement, and I think this is the first step in a journey that we will be taking together, and I welcome that journey, and I am thankful for the partnerships that exist. So with that, I'd like to turn this over to Dr. Matt Falwell and to Janice Scott for the next phase of the lecture. say this. It says your chance to make a difference. And I think that's so profound, because every day we have a chance to make a difference. And every time we have that chance to make a difference, we need to grab it and hold it and move forward. Miigwech.
Tobacco to do the closing today. It's been a beautiful ceremony, and I'm so glad that everybody could be here today to be a part of this wonderful legacy that we have here. Started with RBH being the very first one. I want to say thank you to the grandmothers and grandfathers and the Creator for coming here today and being with us, and for holding off on the weather, on the rain. I also want to say miigwech to the drum group for that beautiful opening song that you shared with us today. Miigwech, drum medicine. Sometimes words cannot convey what we're feeling, and sometimes just being present and holding this feather conveys what we need to convey. The speakers before me shared about the fund, the organizations they work with the hospital, with the Métis organization, and I just want to say miigwech to everyone for everything that you've shared. And in closing, I ask that you travel safe to where you may be heading after you leave here. Travel safe. Aha.
coming, for making your presence here today. A very special event. Thank you to our drummers. That was excellent. And thank you for all of you